Welcome, everyone. Thank you for joining today's session. This is the Community Reintegration Planning Tables project session. My name is Snehal Jambale. I am the Community Reintegration Coordinator as part of the HSJCC Secretariat team. I am joined today by my colleague, Sarah Freckman, and we will be your moderators for this session. Before we get started, I did want to review some quick housekeeping notes, and then I can go ahead and introduce our speakers and begin the session. So I would like to draw your attention to the bottom of the screen. Please note that you can use the chat feature to submit questions. We do kindly ask for question to be written in all caps in the chat before you proceed to write your question out. This will just make it easier for us to find the questions versus just comments or discussion. The presenters will be taking questions at the end of their presentation, and we will do our best to ask as many questions as we have time for at the end. Please do ensure that your microphone is on mute until the Q&A portion of the session. And please note that we are recording this session. We will be uploading this to the conference website for future viewing by those that have registered for the conference. This will be accessible on the platform for 90 days following the conference. I also wanted to note that if there are any documents, which I believe we don't have for this presentation, but if there are any documents that we will share throughout our discussion, we will direct you all to a link where you can find them. And we also kindly ask that you all complete a short evaluation at the end of this session. This is very, very important to us, and we really appreciate your feedback. We do use this information to inform our future events, such as this conference. And lastly, we would like to respectfully ask all of those that are attending today's session to engage with each other thoughtfully and to always consider the impact of your words and your interactions on others. As moderators, we will not tolerate abusive or inappropriate behavior, and we will ensure that anyone who does engage in such behavior is removed from the session. I would now like to present or introduce our presenters for this session. Starting off, we have Tiana Lakovic. She is the Manager of Operations and Implementation Branch for the Ministry of the Solicitor General. We also have here Candice Venna, who is the Director of Justice Policy at CMHA Ontario. And we are also joined by Yasmin Brahimi. Yasmin is the Program Manager at St. Leonard's Community Services in London, and she also is one of two community co-chairs at the Elgin-Middlesex Community Reintegration Planning Table. And last but not least, we have Nolan Zimmer. Nolan is a Community Reintegration Officer at the Elgin-Middlesex Detention Centre, and he also works closely with Yasmin as a CRO, one of two CRO co-chairs for the Elgin-Middlesex CRPT table. So I will now hand it over to our presenters.
Hello all, my name is Tiana Lakovic, and I am a Senior Manager in the Assistant Deputy Minister's Office. I just firstly want to say thank you very much for allowing me the space to come and present today and talk about the partnership that my ministry has been able to establish with PHS, JCC, and some of the successes that we have seen thus far from this initiative. The presentation today is meant to provide background regarding the Enhanced Community Reintegration Initiative and the SOLJA partnerships with PHJCC to develop and implement community reintegration planning tables at select sites across Ontario. We will provide information regarding the structure, function, membership, and evaluation of the local CRPTs, as well as lessons learned. Then we have Mr. Nolan Zimmer. He is a Community Reintegration Officer from EMDC, and he will talk about implementing the local CRPT and its successes. And then we will end with an update on moving from phase 1 to phase 2 of the Community Reintegration Planning Tables and the next steps. So just to give a little bit of a background on the initiative and the project, community reintegration is the process of preparing individuals for release from custody into the community and supporting the continuity of care, as well as assuring successful and sustained reintegration once they're there. Throughout September and October 2021, the Ministry of Solicitor General held 6 engagements with external community partners to discuss gaps and opportunities related to community reintegration to help inform how the ministry can enhance community reintegration planning to support sentenced and remanded populations. Participants included representatives from service providers, municipalities, and BIPOC organizations. Engagements with frontline staff from community correctional services, institutional services, and institutional healthcare provided insight into local practices and gaps in service. When this information was combined, the Enhanced Community Reintegration Initiative was developed to create an inclusive and people-centered approach that is standardized and consistent across the province, that capitalizes on multiple intervention points in the individual's journey and leverages the skills and expertise of the ministry staff, and our community partners. We have used a phased approach, which during the implementation of the initiative overall, beginning of January 2022, community reintegration was introduced at phase 1 sites with community reintegration officers at all of these sites, which are, by the way, specialized probation and parole officers, which are working within our institutions, and they're in particularly working with our high risk and high need individuals that require multi-agency support for their successful reintegration. So that is some of the criteria that the offender must have in order to be considered for our table. The community reintegration form was developed to standardize community reintegration and discharge planning process and documentation and replace any previously institutional specific forms that may have been used. In this way, really creating a streamlined process for community reintegration in all 25 institutions within the province, even the ones that do not have a community reintegration officer on site. In April 2022, the Community Reintegration and Discharge Planning Policy was added to the CCS, Probation and Parole Conditional Sentence Manual, and the Institutional Services Policy and Procedure Manual. This marked the community reintegration strategy being implemented in all 25 institutions across the province. In November and December, the ministry held multiple engagement sessions with frontline staff and really learned best practices that would then be implemented in creating the community reintegration planning tables. The objective being to strengthen community and information sharing between the ministry staff and community staff, partners to support individuals returning to the community by streamlining referrals to network of local community partners to ensure multi-agency support can be assessed for high needs individuals. This led to the ministry and PHJCC entering into their current partnership to develop community reintegration planning tables. And now over to Candice to talk about partnership.
Thanks so much, Tiana, and good afternoon, everyone. As Snehal introduced me, I am Candice Fenna and the Director of Justice Policy at the Canadian Mental Health Association Ontario Division. So I oversee a small but very mighty team at the HSJCC Secretariat that provides support to the regional and local HSJCCs across the province, but also the provincial HSJCC, who is the partner in this project. We were thrilled back in May of 2022 when we first entered into and announced our partnership with the Ministry of the Solicitor General. As Tiana was talking, this is a joint ministry and community-led initiative, which is so important to note. SolGen, of course, is responsible for community reintegration, but this cannot be done alone. This needs to be done in partnership with community and the ministry. And by leveraging what is already existing across the province, so, we have a wide range of expertise within the provincial HSJCC, as well as the human services and justice partnerships at regional and local committees, we can really work together to develop CRPTs and learn from one another. So we're really excited about this. The community reintegration planning tables are really designed to improve that collaboration between SolGen and the community and enhance responsive planning for individuals with high needs and looking at it from a holistic approach. It's a really good opportunity to identify and facilitate access to support at various intervention points. So from the moment an individual comes into the institution, and if they give consent to be part of a community reintegration planning table, a CRO can bring a case forward to the table to identify different supports for their needs. If you could go to the next slide, Sarah, that would be great. So in terms of the structure, we have a co-chair model. As you see, two individuals on the call here today are for the Elgin-Middlesex Detention Centre. So one being the Community Reintegration Officer or officers and community co-chairs. They share responsibility for supporting coordinated and timely planning for individuals, case conferencing, and referrals to those being released from custody. They're also responsible for identifying membership for the table. So you'll note here it says both core and as needed members, and we'll talk a little bit more about what that means and who membership are later. Coordinating and actually co-chairing community reintegration planning tables, and administrative tasks that are necessary to support the ongoing development and implementation of the tables, which also includes data collection, which I'll also touch on a little bit later. The key functions of the table are really to coordinate and triage planning for those individuals being released from custody, again, re-emphasizing that we need to prioritize individuals with high needs and from a person-centered approach that is standard and consistent across all institutions of the province. They will be supporting the collection of community reintegration data through evaluation tools to track the progress of the community reintegration table outcomes. And it'll really give us a chance to understand what their achievements and some challenges that exist at the tables so that we can work more collaboratively together and improve those outcomes for people who are reintegrating back into the community. If you could go to the next slide, Sarah. Wonderful. So here is a snapshot of our membership. So as I mentioned, there is a core group. That would be the two co-chairs, so the CRO co-chairs who are specialized probation and parole officers. Then the community co-chair. Community co-chairs are suggested to be a representative from an organization that has a broad reintegration mandate or expertise. In communities, of course, where there is Black, Indigenous, or people of color organizations that have similar mandates, they should be given priority for this role because they know the needs of their particular individuals that are coming out of custody, and they should be given priority to lead the work of the CRPT from a community perspective. There are other key stakeholders from community service providers, and that includes housing, mental health and addictions, primary healthcare, income assistance, and other Black, Indigenous, and people of color organizations, as well as people with lived experience that may have experience of being released from custody. They bring a unique perspective as someone who's gone through the system. And of course, elders play a critical role as well in being part of this core membership, especially where there's a high Indigenous population being released from custody. We then have as needed members, as we recognize not every individual may need all services available to them. It is specific to their needs on a case-by-case basis. We encourage institutional staff, so those that work inside the correctional facilities, those social workers, Native inmate liaison officers and chaplains to join the table that may be able to provide a little more support and for those that they may be working with that are now being released from custody and need that continued support. And then other specialized support service organizations. So we've included some examples here of ABI, so acquired brain injury, support for victims of human trafficking and domestic violence. If you could go to the next slide, Sarah, that's great. Tiana mentioned we're taking a phased approach, and this really allows for us to evaluate the program, reflect on our lessons learned, and develop some best practices as we move from phase 1 sites to phase 2 sites and hopefully to a full implementation. You can see here that there has been 4 sites that have been launched and are now case carrying, which means they're actually getting referrals to the table between May and July 2023 of this year. That includes Thunder Bay Jail and Correctional Centre, Elgin-Middlesex Detention Centre, Maplehurst Correctional Complex, and Toronto South Detention Centre. We are in the midst of moving towards phase 2 sites that are listed here. So Kenora Jail, Vanier Centre for Women, Brockville Jail, Sarnia Jail, Quinte Detention Centre, and Toronto East Detention Centre, and have been doing a lot of engagement work to prepare as we shift towards phase 2. So I mentioned evaluation. We have brought on board consultants, so the John Howard Society of Ontario and DPRA Canada, who we've worked with in the past who are closely monitoring the development of these tables through data collection and evaluation. The data collected as part of this evaluation will serve to monitor and support our continuous improvement efforts of the tables processes implementation activities. Data collection has three main streams. So there are monitoring tools that the co-chairs complete. So that is a meeting tracking tool, as well as an individual tracking tool. The consultants have also helped us with the development of surveys, interviews, and focus groups with Community Reintegration Planning Table co-chairs, members who actually sit at the tables, other stakeholders, and obviously our partners here, so the Secretariat team and the Ministry of the Solicitor General's team. There's also data collected about those individuals who are within the institutions on their housing, identification, financial status, transportation, and high need factors like mental health issues, substance use issues, and their healthcare needs and any vulnerabilities. So I think, yes, I was just going to pass it back over to you, to Tiana, and we're going to talk about what we've learned, because we've learned a lot.
Exactly. And I think that even actually before we started off today, we both, Candace has been enjoying herself and has been listening to lots of you folks share wonderful lessons learned from different initiatives. And I think that we both just kind of said, you know, we're in this for the long haul. This is a project that will take us 5 to 10 years to really set in stone. So talking about relationships, so relationship building, one of the main goals of the Community Reintegration Planning Table and the project and all of our relationships all together has been to build stronger relationships between the ministry and our community agencies that are providing our justice involved individuals with services. This is a new way of working, and it takes time and a cultural shift for both the community as well as ministry to truly build those collaborative and trusting relationships. During phase one, we learned a lot on how to make communication better between both the ministry and our community partners. And we're constantly learning, and we're constantly really listening to that frontline feedback in order to improve for the next phase. So we've learned a lot from phase one, and we'll be implementing those lessons learned for phase two as well. And this is exactly the messaging that we have the opportunity to each give back. Candace, when she's collaborating with, and Candace and her team, when they're collaborating with community agencies, and myself when I'm collaborating with folks that are in operational services as well. We have learned a lot from our local Community Reintegration Planning Tables co-chairs in particular, and how they work together and share information with each other. And it's very unique at each site, and we're learning a lot from those differences as well, that as much as we thought that a one-fit-size-all model was going to work, in fact, we are having to make adjustments to make sure that we're truly feeding the needs of the client base that from that particular area. For example, in implementing phase one sites, ministry staff and community agencies work together to share information about how referrals are made to service providers, what relationship processes are already in place, what other initiatives designed to support reintegration were already working, and the gaps or communication barriers that exist. Over to you, Candace.
Yana, I just want to echo your comments. I was sharing earlier that we just had a wonderful keynote panel on crisis response models, and they were really highlighting the importance of building those relationships. It takes time, it takes a lot of effort, but we're committed to the long haul. So thank you for highlighting all of those points. So community capacity, I don't think that's a surprise to anyone. Both SolGen and the PHS-JCC heard a lot about capacity issues even from the onset of this project in the community sector. We heard from community co-chairs and member agencies about their limited capacity to attend regular meetings. They're already sitting at many committees and various tables. The ability to accept referrals because they're already having full caseloads. There's rising programming demands, more complexities to serving individuals, and competing time commitments. And we know this is further exacerbated by the ongoing human resources crisis that we hear about quite regularly from our nonprofit sector. It's led to a lot of staff vacancies and challenges with employee retention. So we're very much aware of that. We have ensured funding to support these tables to try and mitigate some of the administrative burden on the community co-chair. And to address some of these capacity issues, we're trying to leverage what's already in place so we're not duplicating our efforts, learning from local service providers about the best way to use their time and how to work best together. Back over to you.
A good example of that would be Thunder Bay, for example. You know, we're learning a lot about some of the situation tables that are very much so established in that area. And what can we really learn, and what can we leverage to as we're planning out our community reintegration planning tables? So the majority of the individuals in Ontario's institutions are on remand, and that number is growing. So it can be very difficult for community reintegration officers to really develop relationships, firstly, in order to develop reintegration plans, because individuals are released with such short notice. Local community reintegration planning tables have had difficulty making referrals to community services for complex clients who have serious charges on their criminal records. For example, there is arson, violence, there is restrictions for sex offenders and what areas they may live in. So these are some of the barriers. Long waitlist organizations have made reasonable responsive planning difficult, and we are working with local service agencies to identify opportunities to overcome some of these barriers. So next slide, please. Some of our institutional challenges that we do experience, and their operational realities, to be honest. There are some institutional challenges that have made responsive and holistic reintegration difficult. For example, many individuals in custody do not have identification. As a matter of fact, we did data pull from the offender tracking information system, and that is basically a big database where information is stored about our clients, and over 50% of our clients identify not having any kind of legal identification. So we can appreciate that that is a major gap. Healthcare and healthcare-related services are especially difficult because while individuals are within correctional institution, their health is not overseen by the Ministry of Health, and this can make it difficult to make referrals to healthcare services in advance of release. Likewise, a person may be receiving medication inside of the correctional institution and may not have a doctor in the community to refill their prescription. Further to that, if they don't have a health card, they can't fill their prescription whatsoever. So again, going back to the ID gap. Discussion of how transitions in care aim to address some of these gaps and how it fits with the community reintegration planning table. And my wonderful colleague, Brad Tamsu, is here on the call with us as well. And that is a project that he has been leading within our ministry. We aim to ensure that all referrals to the table are done in a consistent manner across institutions with community reintegration planning tables and in line with the provincial framework and referral pathway that has been developed. The ministry regularly meets with community reintegration officers across institutions and other institutional staff to ensure consistency across the tables and also conduct site-specific meetings. So to give you an example, I was at Vanier today, and we did speak about some gender-specific community reintegration needs that are needed, in particularly at that institution, as it is a female-only institution. In addition, our community advisory committee, which brings together all of the community reintegration planning table co-chairs, both community and institutional, provides an opportunity to address discrepancies and issues at different sites and learn from each other. Over to you, Candice.
Thanks, Tiana. If that's not enough challenges as is, we have our systemic issues. I think we could provide many examples, but what we wanted to focus on today is what everyone knows and has been talking about within this conference and outside of this conference is housing. We know that housing is a key challenge for any effective reintegration. There has been several academic reports, consultations, discussions that point to the fact that without a place for an individual to go and have a safe place, they're not able to get the supports they need and properly reintegrate back into the community. We really are focusing on the needs of individuals, the specific housing needs of individuals. It's a top priority for the CRPT project. We're ensuring that each of the CRPTs have folks from the housing membership from their sectors, so supportive housing, shelters, as well as representatives from the Ministry of Municipal Affairs and Housing and Ministry of Health, to ensure that we are coming up with innovative ways to provide that housing for individuals. I was in the session earlier today, and I've seen some folks that are from that region in Windsor that have the coordinated hub that focus on housing, but a number of these other challenges related to ID, healthcare. And I think these are models that we can continue to explore and advocate for, work with our interministerial partners, and find innovative ways to ensure we are supporting individuals, that there are lower barriers to getting those supports, and they have a place to call home. We do have local examples of CRPTs working together in partnership to address the housing crisis for individuals leaving corrections. So, for example, in Thunder Bay, they're working with John Howard Society there to dedicate 5 of their existing beds specifically for those that are being released, part of the CRPT project, that have those high needs. We're really thrilled to see that and want to see where we can leverage other opportunities across the province. But we know that we have a lot of work to do on that front. The data collection and evaluation portion of the CRPT will further support the need to identify supportive housing program and other housing supports. And as we always say, this is a marathon. This is not a sprint, but we are committed to addressing housing as our top priority for the project. We could go to the next slide. I think I'm turning it over to our presenters from Elgin-Middlesex.
Thanks. Hi,
Over
everyone.
to you, Nolan.
Hi, everyone. My name is Nolan Zimmer. I am one of 3 community reintegration officers at the Elgin-Middlesex Detention Centre. While I'm here representing our team, all 3 of us do attend our CRPT meetings regularly, so all members of our team are involved. What I wanted to go through today was just kind of our table formats. As noted earlier in phase 1, various institutions are running CRPT, but they are different to those communities, and that's no exception for London. So, for example, in London, we're meeting once a month right now in person with our core members and as needed members, and our meetings are taking place at the London Core Probation and Parole Office. The reason that we decided to do it in person and with these core members is because it allows the supervising officers to come in and actually provide additional information for the individuals that we're presenting. Currently, we're presenting approximately 4 cases per meeting, so we're taking about 20 minutes per client to discuss reintegration planning. When we are presenting these individuals, we do have a CRPT outline that the CROs are completing beforehand. Basically, in this outline, we're just identifying the areas of need that each individual has. So, for example, if it's ID, transportation, housing, we want to make sure that we're making it clear to the table of what this individual is looking to identify in their community reintegration plan. Following our community reintegration planning table, we've set up these, what we refer to them as little mini meetings. So whatever agency has put up their hand and is willing to assist this individual, we will schedule a virtual Teams or Zoom meeting with all these members, and we're going to try to collaborate with them and schedule appropriate meetings with the offender, get them into the institution, and make sure that everyone's on the same page. Because if we're working with these high risk, high needs individuals, we want to make sure that everyone is involved, everyone's on the same page. And by doing these mini meetings where, people are putting their hand up and say, yeah, I'll identify the ID piece with this individual. Yeah, I'll identify the housing piece. So it allows for a more collaborative approach when we're discussing these reintegration plans. Now, from a CRO perspective, when we're going in and we're meeting with these individuals and we're considering who we're going to be presenting at the table, there's a number of things that we're looking for. As noted before, they need high risk, high need, but there's other things that we're looking at as well. It's like, does this individual currently have community supports, or there's no community supports involved in the release plan currently? We also want to consider if there's an upcoming release date, or if we know from the courts if this individual is being held on remand, if they're going to be sentenced, to ensure that this individual has a sound plan for when they are released. When we're approaching these individuals in the institution, we have found that most of them are willing to be presented at the table. I think we've only had a few that have declined so far, so we've been really successful in presenting it. And when we go and we talk to them, we bring them into a room that's one-on-one. There's no one else around. There's no other inmates around. And we do review the list of all community agencies involved. So there is transparency there. They know who's sitting at the table beforehand. And like I said, we've had a lot of success with that so far. Some positives from a CRO perspective before I turn it over to Yasmin to give the community perspective. This table has really allowed for a lot of networking between our CRO team and the community. I mean, I can't stress that enough. Meeting in person has been so beneficial for us, just to everyone to sit down, communicate what their agency is willing to identify with them, and really lean on those agencies for their expertise. For example, we'll sometimes walk into meetings and not know the exact procedure on how to apply for ODSP or where to send someone for their medication. And this table is allowing us to lean on those community partners and their expertise in order to make sure that we're giving this individual a sound release plan. So we've just found that incredibly beneficial from a CRO perspective. With that being said, I think I'll toss it over to Yasmin to add anything from her side as our community co-chair.
Thanks, Nolan. Okay, just to reintroduce myself, my name is Yasmin. I work for St. Leonard's Community Services in London, Ontario. So Elgin-Middlesex Detention Centre is right in London. We're quite familiar with it. And I manage the reintegration and release from custody programs. So this is definitely right up my alley. And I've been involved since the genesis, which means that I have seen the challenges, but I've also been delighted to see how we were able to overcome them, adapt to them, and we've been able to get a flow going. So that's a big achievement, and I'm grateful to have been able to witness that. I will start with some of the challenges that we experienced at the beginning. So we were acutely aware of the time commitment that was required of us and of our community partners. Now, I'm grateful that I have another community co-chair who is also very knowledgeable, very committed, and poses wonderful questions. So it's been a learning opportunity for me, as well as the CROs are very passionate and good at what they do. So I truly believe that this was luck in that we work so well as a team and we all share that mission. So that's been our driving force, and that's been what kept us going through the challenges that we experienced. So we were able to recruit some community members, which, as Nolan mentioned, allowed us to get to know more of what's out there. Now, Candice did mention some of the complexities, and I really like the analogy of a marathon. You're running a marathon, you start within the first kilometer, you're like, I'm over this. Why did I sign up? This is so hard. But then you persist. And then you're just like, this ain't no thing, right? It's easy breezy. This is exactly like it. So we were intimidated by the very complex cases that were coming to us. We were seeing compounding factors, like it wasn't just the homelessness piece, it was substance use, disguised with mental health concerns, but there were no official diagnoses, and we weren't sure if it was long-term substance use or an actual mental health condition. For some women, there was sex work that was also preventing them from moving forward. So we were really unsure of what do we tackle first? And of course, if you subscribe to the housing first philosophy, that's what you do. But as we mentioned, that's our biggest challenge, right? Housing. And I think, and please correct me if I'm wrong, Nolan, I think most of the cases that come to us don't have housing. So there was a moment where we were stuck, and we could see that our community partners as well were unsure how to proceed. Additionally, some individuals do have a lot of aggression. Understandably so, if you're homeless and there's no way out. But a lot of other community members weren't able to support. A lot of the community agencies weren't able to support because they had anyone who has a history of aggression or like arsonism or whatnot, they wouldn't be able to take them, and that was their policy. So it limited it to just a few agencies who end up taking anybody, no matter what happened. And my program is one of them, but I'm also acutely aware of our long wait list. But thankfully, we were able to get familiar with the other agencies that can support with the additional gaps, such as getting ID, getting counseling, anger management, etc. I also do want to mention a systemic issue, specifically with BIPOC individuals. We were thankfully able to get connected with Indigenous resources. However, being able to find other resources that support individuals where they are at, be it, you know, being a newcomer, a refugee, Black individuals from different faiths, we weren't able to find those resources, and the ones that were available were too busy, because if they are the only resource in the community, you can imagine just how busy and overwhelmed they are. On the other end there, we didn't get a lot of, actually, I don't think we reviewed anybody who identifies as BIPOC, but that doesn't mean that they're not there. So it does make me wonder, are they flying under the radar? Are we not seeing them? Are we not catching them? And as such, even if we do, are we going to be able to provide them appropriate resources and supports? Now with the achievements, we have been able to ensure continuation of service. So here we are deep into the marathon and we got a flow, we got a good pace going. And it is really nice to see that we are just getting better and better at holding these meetings, being efficient, and following up with what Nolan mentioned, those little meetings. They're very helpful. We are trying to achieve door-to-door supports, meaning they leave the institution and are right to the next door. They are right into a private shelter room, so that there isn't room for them to fall back into old habits. And falling back into old habits means falling back into the old environment that got you into those habits, right? So we are trying very hard to avoid that. And with that communication with all the supports, the shelter, the discharge, the discharge team at EMDC, and then maybe someone who can provide them with a ride, that really helps. And we've been getting creative with using the funding that we were provided with. So one example is getting our clients phones, flip phones, because communication is a very big need as well. But not everybody can just go and get a cell phone plan, especially if you don't have your own money, ID, and all that. So providing them with phones so they can call somebody, ask for help, be able to meet with other workers can really help fill a gap. We also got them gift cards for stores like Giant Tiger or Walmart, so they can, with a dignity, go and acquire things that they need. Some individuals may have been incarcerated during the summer and then they're released in the winter with their summer clothes. I mean, there's a lot that's being missed here. So at least when we give them that Walmart gift card, they can go get a hot drink if they want from the McDonald's in there, but then also be able to get some boots, some socks, a sweater, so they can at least be dignified in their next steps in their journey. Let me just see, I don't want to miss anything. So this has also provided me with a lot of optimism in that, like, community members now are aware of each other, and some of them are now reaching out to each other even outside of the CRPT. So a successful example of that is I had an EMDC social worker reach out to me and ask about our reintegration program, and then connected to me with other resources that she met through the reintegration, through the CRPT. And then we all got an email chain going so we can support her high-risk client who was getting released later that week. Again, not a CRPT client, but because of our collaboration that was initiated by us knowing about each other from the CRPT, we were able to get him that door-to-door support. We were able to get him the wraparound support so we can target all of his needs. And just this morning, beautiful timing, my reintegration worker sent me an email that she got from said client, and he said, I personally am amazed with the support. It seems that after years of hearing people telling me how supported I am out here, I'm actually receiving and feeling the support that they claimed I already had. So we are walking the walk, and that is very encouraging. And I think it'll help us get through this very long marathon. And it is building us as well as workers, as managers, as leaders. It is building us and teaching us those skills that we need so we can best support those who we want to help. So thank you.
I think it's back over to me now, but before I go, I just want to thank Yaz and Nolan for sharing your experiences and being very real and honest about, the challenges, but also some of the successes. As someone who worked in the front line a long time ago and now doesn't, I'm not in it every day, and we hear of what's happening, but to just hear how you've navigated, you're in the marathon, and you're sharing examples of what is going well and what still needs work, really motivates myself and my team, and I know Tiana would say the same thing, to continue to learn from everyone in the CRPTs. It's just such important work, and we have a long way to go, but I'm really glad to hear that things are, at least in some areas, making an impact. And I almost teared up with the email that you just shared from your client, but that was I'm really glad you shared that with us. So thank you both so much. That transitions me well into what we're doing now for phase 2, based on what we're hearing from phase 1. So we've been doing some work over the last several months, actually, because we recognized in the beginning, when we were rolling out phase 1, we would come across some bumps along the way. We only knew what we knew based on existing structures and HSJCCs. So this time around, we really reflected on some of the feedback that we got from our many partners and began some proactive outreach to community partners in the next phase 2 sites, really to identify what their local issues are, what are some barriers faced, what are unique characteristics of the geography, service gaps, how they're already working together, if there are tables already in place. And it's already helped us move towards getting the phase 2 sites in a place where I think we'll have a smoother transition. We know there's still going to be a lot of work on the relationship side and working through some of the internal challenges that we mentioned before, but we're in a really good place. We are also learning from our ongoing evaluation and monitoring of the site. So we have an interim report that is just being completed now from the first 4 sites that we are happy to share with folks once it is complete, to the Provincial HSJCC and partners. Based on what we've learned from the environmental scan and the evaluation, we're looking to identify those community co-chairs for the next 6 sites for this part of the project. I will turn it back over to Tiana just to talk about what's next before we wrap up for Q&A.
So what's next is that we're going to keep on working on our partnerships, working on our relationships, and keep on growing the community reintegration planning tables and bringing it to many communities across the province. And the community reintegration planning tables are really just one part of thinking about community reintegration. And this cannot just be done by my ministry and PHS-JCC. I just was at, like I said, I spent my morning at Vanier, and we spoke about housing for over an hour, and just some of those gaps. And I think that we all collaboratively need to look at community gaps like that and start addressing them together. So many barriers to reintegration stem from systemic issues, and it requires the development of partnerships, not only between community and SolGen, but also between other ministries. I think that we have all said it a couple of times. This is a marathon. I keep on stating that I think that this will be a fully implemented model in the next 5 to 10 years. It takes a lot of time to make any project initiative come to fruition, especially if we want great outcomes. We know that it's hard for people working on the front line, both in the community and in the ministry as well. And we both face our own, honestly, right now, HR issues. And I think that Candace went over some of them, and we're very much so experienced in the exact same ones. Additionally, also with challenges with our clients, which we also talked about as well. Both SolGen and PHJCC are committed to doing this work together, to supporting frontline staff to develop local solutions and to working with our ministry partners to make long-term systemic change. You have our commitment and continued ongoing support.
Awesome. Thank you, everyone. I can start sharing some questions that we've received in the chat. So our first question was, and I am assuming this is specific to SolGen, do you have the stats for individuals that are released to no fixed address?
Those will be statistics that we could pull forward, but they're not a true reflection of the underhoused population, unfortunately, due to many different complexities about what's really safe housing, really. So I guess it's a yes kind of answer, and it's yeah.
Thanks, Tiana. This isn't a question, but this is a comment from Lindsay that I really would like to share with everyone. It says, if we are looking to make a culture shift, I would like to suggest that we try very hard to stop using language such as offender. Let's use person first, charges second, such as person who has alleged sexual charges or person with sexual charges restrictions. So I know we can all do better in our everyday lives and our professional work to make that change. So I really appreciate that comment, Lindsay. Thank you. We have
May I just speak to that for one moment?
Yes.
For us in the ministry, that's actually policy. Offender is what we refer to clients as. So that was my language, and I would like to apologize for not thinking of the space and maybe rephrasing some of my language, but in written form, that is always the way that we communicate. So I do apologize for offending.
Thanks, Tiana.
Can I just want to push back that yes, it might be policy, but we also make very conscious efforts to identify people as woman or man, if how they want to be identified personally. And so this is also just honoring changing language, and that means challenging policy. And I'm speaking as someone with lived experience who is still labeled an offender to this day. And I haven't been in trouble with the law in over 20 years. I'm not making this about me. I'm just saying that we have made transitions and a culture shift in many other areas. And we take an anti-oppressive, anti-racist view. And I think that, you know, calling people offenders when they're not offending anymore or when they're in the community, it's actually really harmful and it's limiting, and it contributes to the enormous stigma of us trying to reintegrate into society.
Thanks for sharing that, Lindsay. We have another question here from Mandy. How can community agencies or hospitals join a table? Mandy, I would kindly ask you to reach out to Sarah or myself. We would be more than happy to assist you in that. I can share both of our email addresses at the end of the session for you to connect with us. We have another question. It says, do you provide naloxone to people leaving institutions in your door-to-door services? So this would be really open for Yasmin and her expertise.
Yes, yeah, we would be providing naloxone kits. For some of them, we have been able to work collaboratively with EMDC nurses to also get them connected with alternative opiate therapy. So be it Suboxone, Sublocade, methadone, all that good stuff. And yeah, for sure, we would be connecting them with the naloxone kits too.
Awesome. Thank you, Yasmin.
I also just want to add to Yasmin's presentation. There was an important presentation given in a panel earlier today, A4, which will be online in a recording, and it talks about the mental health and substance use work that the ministry is doing. And they do talk about the provision of naloxone kits as part of the reintegration work that the mental health team is doing, which is a different team than the community reintegration team, but they're all in the institution and working on it from all sides.
Thanks, Sarah. We do have one more question in the chat, and then I can turn it to Martin. So from Shaylee, it says, is there a CRPT in Ottawa? I don't believe I saw this on the PowerPoint. So to answer your question, no, we don't have one in Ottawa as of yet, but you know, we would like to expand the project as much as possible. So we would like to get in touch with you if there is any information that you'd like to share about the region that we may use in our future initiatives. I'm not sure the first name, but Martin from Elizabeth Fry, feel free to share your question.
Hey, no, I just really quickly had a comment about the providing naloxone to folks who are leaving the institution. We just did our provincial advocacy visit at Vanier last week, and particularly that institution doesn't give out naloxone unless folks are asking for it. And one thing that I think would be extremely important is that could be a policy for all of SolGen to ensure that individuals who are leaving prisons, that they're able to access that without having to ask specifically. So just from some feedback that we've heard from Vanier specifically last week, that this is not necessarily happening.
Thank you for sharing that. We don't have any further questions or comments in the chat, so I would like to open it up for any hand raises if there are any questions or comments. Okay, that's looking like we covered most of our questions. So I would like for all of you to please join me in thanking our speakers for their great presentation and for sharing their knowledge with us. I know it was very, very informative for myself, and I am quite deep in this work, but I feel that I learn something new every time that I speak with any of our co-chairs, really. So thank you again for attending and for sharing your expertise and your knowledge. I would also like to kindly ask our attendees to please take a few moments and complete the evaluation. That link can be found at the bottom of the session page. If you are unable to find the link, please let me know and I can share that with you all. And again, just thank you to our speakers and everyone for your participation and especially your insightful questions and comments. Please do join us in the plenary room for our day one closing remarks.